I'm Rhiannon Moline. I'm 15, right? Yeah, I'm 15. Um, I'm from Winthrop, Massachusetts, and I have Ehlers-Danlos Syndrome.
And my name is Maegen Brady, and I'm a physical therapist. I started working with Rhiannon in 2015 before she was diagnosed with Ehlers-Danlos Syndrome. Ehlers-Danlos Syndrome is a rare genetic condition that affects the connective tissue in the body. Usually only about 1 in 5,000 to 1 in 2,500 people have this condition. And it presents in three characteristic ways. The joints may stretch farther than they should, the skin may stretch farther than it should, and this may cause some fragile tissues in the body.
I wasn't really thinking about it until I was taken to a geneticist in September of 2016, so when I was in 8th grade. But I think I displayed symptoms throughout my whole life.
Rhiannon was referred to physical therapy because the chronic dislocations in her knees was preventing her from participating in the recreation she wanted to, including taekwondo and swimming. These issues had even affected her ability to participate at school, so limitations in gym with her classmates, and even walking up and down the stairs to classes was becoming difficult.
And then I came here and it was fun, but I didn't like you at first.
Patient resistant to physical therapy and non participation in recreation.
Well, I don't hate you now. I like to think that we're not. Yeah, it's funny, I know. Doing physical therapy, it is easy at times and it's hard at times just because EDS gives me good and bad days.
There's been a long road and there's been a lot of obstacles and barriers along the way, but it takes communication, flexibility, and a willingness to meet your patient where they are so you can continue to meet their needs.
Well, now I'm mostly focused on the arts, and I'm part of the drama society, so I'm on stage all the time. I'm also part of the technical aspect of drama, like building sets, running lights, stuff like that.
Rhiannon is super passionate about theater and music, so we utilize that in our treatment sessions. While she was preparing to be part of the ensemble in Rock of Ages last year, we used some of the 80s metal songs to help guide and progress some of our exercises.
One time in here, because it was a piece American River Songs where I was just playing nonstop for 3 pages, and that's a lot of holding it up and just going. So I sat in here in front of the mirror on the yoga ball, and I just sat there with my flute, building my strength, and then I will hold it for longer and longer and longer and longer. And even if that's not a big exercise, it's big for me. So it is a big exercise.
When working with someone with Ehlers-Danlos syndrome, it's really important to get a whole picture of the person. So where physical therapy can help with strengthening and avoiding joint dislocations, it's important that we create really a whole team around this patient to address any other health needs and conditions that also come up.
The patient probably knows more than you because they've been doing it their whole life and you've just met them. So don't try to say, let's do it this way, and then when they say that way's not going to work. We should want to try things, even though I got scared, I still get scared, and I'm sure everybody else does. We have to work together. I work with Megan works with me.
Our goal in bringing our story forward is to educate other folks with Ehlers-Danlos syndrome, other physical therapists, medical professionals that want to learn more, because education and awareness is the keystone to progress.
A lot of it is mental health, too. So just keep track of that as much, if not more, than your physical health, because if your brain isn't thinking, then your body isn't bodying.